Hi, I'm Dr. Gottenborg, and today I thought we'd talk about, I think, a really interesting subject. In fact, this subject began from an appointment of mine probably just less than 1 hour ago. So the question is, when you hear the words neuropathy, you've probably heard words like this when people talk about peripheral neuropathy or diabetic neuropathy. What's the difference between that type of pain or symptom and when people talk about neuralgia? Or is that different than the pain from the spine when someone describes, I think I might have a pinched nerve? So I have just a simple example here today that I think will tell a little bit about neuropathy. In this example today, the nerve is the blue wire. The blue wire is surrounded by a sheath that envelopes the wire or nerve. If anything happens that disrupts the sheath, where in a sense the sheath unwinds or unravels, it leaves the nerve exposed. At that point, this is when someone would start to realize symptoms. They might be numbness, tingling, prickling. This could actually progress into weakness. Some people have a poor sense of balance. This is what people call peripheral neuropathy. Some will call it, that are diabetic neuropathy. Another example could be carpal tunnel syndrome. Neuralgia means nerve pain. And people that have neuralgia, think of someone with shingles. Following shingles, or even during the shingles lesions, they have this sharp, stabbing, intermittent. In other words, the pain may come and go. And for some, it can be terribly disabling. The same process happens here where the virus now attacks the nerve and can begin to unwind that protective sheath around the nerve. The last one is nerve pain, when people have a structural problem like a herniated disc. And in this example, I'll just use this tube here, is that nerves are very sensitive and responsive to pressure. So to have nerve pain, one doesn't need anything more than just enough pressure to indent the nerve. Very low pressure system can cause a lot of pain and a lot of symptoms. Usually one side, one leg, one arm, rather than left and right. All three of these conditions, if left untreated or allowed to progress for any time, all fall under the category of a nerve that has been injured, that nerve has degenerated, and it fails to heal correctly. So medically, your options are a lot of things like drugs like Cymbalta that can be used for depression. It may involve drugs like Neurontin, a GABA drug, or Lyrica, commonly used for people with diabetic neuropathy. What we try to do is, I think the false sense of what happens to people is they group all of their symptoms with neuropathy or neuralgia. So while that may exist, there may be other things as far as alignment, structure, the position of one vertebrae to the next, and how that affects pain. So we think an exam, no matter what, is important. There are things that we offer to patients nutritionally. We know that there are certain B vitamins that are important for good nerve conductivity, including things like fish oil. So we use strategies like that when we assess people and when we proceed with treatment. We believe that doing nothing other than taking medication does only one thing: the condition progresses. One other option in closing that we use in our clinic is a form of electrotherapy called microcurrent, effective at stimulating tissue repair. And what we do here is we place a small pad on both sides and we run a low frequency current following the path of that nerve. We know that that current not only has a steadying or calming effect on the nerve, is that between the two pads it increases blood flow, which is important for healing. So we use this along with other things that are common to most chiropractors, including nutrition. So in closing, if you have questions as to are you getting the best care that you possibly can when you think of the word neuropathy or neuralgia or a pinched nerve, we feel that we can help you answer those questions and give you, hopefully, a good opinion. Thank you.
Thank you for watching Wellness for Life.